For the last few years, we have heard a lot of promises about artificial intelligence, that it would change work, change business, change productivity, really change everything. And sometimes that conversation can feel abstract. Another tool, another model, another headline. But then you find places where AI is being used for something much bigger, something like cancer research. Because this is where the promise of technology gets very real. Not just faster emails or better workflows, but new ways to study disease, identify targets, evaluate possibilities, and potentially open doors that were harder to reach than before. So today, we're talking about AI, biotech, cancer research, and what happens when advanced technology is pointed at one of the hardest problems in medicine and human history. Let's start it up. So, hello and welcome to Stack and Startup, where we talk with founders, operators, creators, and business leaders about the realities of building something. Today, I'm joined by Dr. Dowdy Jackson, PhD, Scientific Officer at Antigenix Therapeutics. Dowdy, how are you doing?
I'm good. How are you doing, Jason?
I'm doing great. And I've told you this several times, and I will be saying it several more times. I am really excited for this conversation because a lot of AI talk up to this point has been very TED talky, very theoretical, and
Right.
very, just like I said in the cold open, abstract. So to have something that is one of the promises in the oncology space is just,
Mhm.
I'm looking forward to this.
Yeah, same here. Thanks for the invitation. Really appreciate it.
Absolutely. So, Dr. Jackson, tell us a little bit about yourself and about your business.
Yeah, so a little bit about myself. So I have a PhD from molecular biology and biophysics from Northwestern University. Did my postdoctoral fellowship at University of California, San Francisco, primarily looking at cancer biology. And then have worked for a number of different biotech and pharmaceutical companies over my career. It expands about a little over 30 years now. And I've been more focusing on developing these molecules, and we'll talk about it a little bit later, called antibody drug conjugates, which essentially allows physicians to deliver chemotherapeutic drugs directly to the tumor. So you reduce these side effects that are commonly associated with cancer therapy. So currently, I'm the chief scientific officer at Antigenix Therapeutics. We're a small biotech startup, and we're focusing on developing the next generation of antibody drug conjugates to help cancer patients.
That is absolutely amazing. uh, that we have that we're at the point where we're being a lot more targeted because the way that me being a layman on cancer treatments with
Mhm.
radiology and chemotherapy, it seems more like you're trying to poison the patient and hoping that the patient wins out. Is that kind of a very generic way of looking at it?
I could understand why a lot of people think that as well. But I think that what you're trying to do with chemotherapy is take advantage of the weaknesses of the Achilles heels of the tumor, which is they grow fast, right? They're rapid cell turnover rate, as opposed to normal tissue would have slower rates. What happens oftentimes is that because it's not targeted, you will have these side effects on normal tissues, like your blood cells, or red blood cells, your white blood cells, things like that. Certain tissues will be affected because they have a higher turnover rate as opposed to some other tissues, right? And with chemo with our type of method, you will have some side effects, but they'll be dramatically reduced overall compared to what chemotherapy is. So usually for our clinical trials, we're compared against the standard, which is chemotherapy, relative to our targeted molecule. And when those studies have been performed in the clinic, there's been numerous examples that have shown that these antibody drug conjugates are far superior to the chemotherapeutic drugs on multiple fronts in terms of shrinking the tumor, decreasing side effects, longer sustained inhibition of tumor growth, or in some cases, even elimination of the tumor.
Awesome. Yeah, I am somebody who is somewhat susceptible to certain types of cancer. Also, some things
Hmm.
I did in the military, some things I've
Yeah.
been exposed to, especially going up inside the mast while all the radars are rotating and radiating. Let me tell you, I'm not looking forward to what that might cause me in the future.
I hear you. I hear you. But I think that's the thing. It's like, for a lot of these different types of cancers, there's really it's been defined as a disease of getting older, right? Because as you get older, some people are more susceptible to certain types of cancer. You have genetic factors, you have environmental factors, combination of both. So as you get older, you see certain people who develop certain types of cancers. Like heme cancers, they're developing probably a lot of times in younger cancer patients, and we're trying to understand the genetics of why that occurs.
Yeah, and I've been in a lot of older schools, being in my early 40s, we definitely had asbestos in a number
Oh,
of the schools that
oh
I've
God,
been in.
yes.
To
Yeah,
the point where there were certain tiles that if you walked on, a mysterious white puff of something, don't know what it
right,
is, but we
right.
know what it is.
Exactly, exactly, exactly. You bring up a good point. I mean, that's why a lot of like a lot of regulations have been put in place to try to minimize our exposure to those types of potential carcinogens.
Absolutely. So let's go into a little bit of the AI research because that's really kind of what
Hmm.
we're here for. And
Right.
when you're talking with somebody and you say AI in cancer research, what is something that they usually misunderstand?
They think AI has all the answers to everything. It's almost as if they believe that, AI is this omnipotent being, right? Whereby they will ask a question, it will give you the answer that you need to know.
We'll
And
give
I
you
think
an answer.
it will give you an answer, and you need to have the ability to know whether or not the answer is correct or not. And to me, that's one of the challenges that I see a lot of people going online, asking Chat GPT about their symptoms, and then, not really going to the doctor per se, but asking Chat GPT, about what's going on with them. And then all of a sudden they've diagnosed themselves, which is completely, not the right approach. I've talked to even some family members about that.
There sometimes are some safeguards where your initial question, ChatGPT may say, "Hey, I'm not a doctor. If you have these concerns, go consult a doctor."
Hmm.
But from what I've seen from different news stories, that it's one of those things where if you keep asking the question, it's eventually going to tell you something. And now you haven't really gone into how the models in your research necessarily work, but I assume
Right.
it's not like, hey, model, you know, tell me how this interaction goes. You know, tell me a little bit of how that interaction works.
It varies on the question that we're trying to. So let's just start with targeted first, right? So since this is a targeted therapy, we want to make sure that we're delivering that cytotoxic payload or the chemotherapy directly to the tumor. The question is, how do you do that, right? So what we will do is develop these things called antibodies, right? Antibodies recognize different the thing called antigens. So it's a body's way of recognizing something as being foreign, right? So we will develop these antibodies against certain proteins that are expressed at the cell surface of cancer cells. So we can deliver the chemotherapeutic therapeutic drug right to those cancer cells expressing that antigen on the tumor, right? So one way in which we use AI is to try to help us identify what are the best tumor antigens that we can use, which means that we have to go through the whole process of looking at essentially what's on the cell surface of these different types of cancers, identifying what the right proteins are going to be to target, and then developing those antibodies against those targets so that we can get really selective targeting to the tumor and not really to normal tissues.
And when you say delivery systems, because I also feel like with how sci-fi works, some people might be picturing a like a pill that
Mhm.
has a little propeller on it, like a little body submarine that has a payload in it. It's nothing like that, right?
Not really, but not that far off.
Oh, okay.
I think it was more of like a smart missile, right?
Okay.
Where remember, like with the smart missiles, you can essentially take that missile and take it right to a specific window in a house you want to blow up, right? For example, right? So essentially, these are like smart missiles for chemotherapeutic drugs. So essentially, they just what we do is we chemically attach the chemotherapeutic drug to these antibodies. We inject them IV into patients, and then they go right to that tumor, and then selectively kill that tumor. That's the concept at least, and that's what's been shown so far it occurs in the clinic. The challenge is for us is going to be a couple of things. Tumors change over time, right? So over that time period where the tumor is changing upon treatment, how do you maintain that pressure to kill that tumor is one of the challenges. The other one is also, how do we also minimize the what we call off tumor effects that can occur on normal tissues. So that's what we're doing. Well, as I mentioned before, a way we can use AI is to identify really good targets that are highly expressed and selectively expressed on tumors and not either not expressed or expressed at really, really low levels of normal tissues. So we developed this thing called a therapeutic index. So the therapeutic index is like, you know, what type of dose do we need to have an anti-tumor effect relative to what the dose is that where you see these non-tumor toxicities or side effects.
And your AI models, they help you to develop those patterns or to see those patterns and then evaluate further.
Yeah, exactly. Especially as it relates to identifying targets, things like that. So you can use machine learning technologies to help us identify what we think are the best targets. One way in which we do that is that they have this thing called a cell surface proteome, and you can essentially look at the entire cell surface proteins that are expressed on a tumor cell and begin to try to ask questions about what we think are the best targets based on historical knowledge. The challenge with AI, though, is going to be what we've encountered so far is that when something works well in the clinic, everybody wants to talk about it. When something doesn't work well in a clinic, nobody really wants to talk about it, right? So what happens in your model, sometimes you can have biases in your models that will drive you to one set of targets relative to another because target A, for example, right, have been successfully developed. Successfully developed therapeutics against target A, not so much against target B, right? Doesn't necessarily mean target B is bad, but there's less data. And since AI is a hugely data-driven process, you can get biases in your models. So we have to account for those potential biases in the models as we go through the whole process of using machine learning to help drive this decision point to identify, for example, what we think the best targets would be.
So, as far as those biases are concerned, I'm again, I'm a layman in a lot of medical aspects and all that, but I do understand about how AI works. Does that mean that if your AI detects a failure, that it doesn't necessarily try to hide it, but
Hmm.
it puts those biases in there so that it wants to, because AI, the way that we've developed it so far, and I don't know if your model accounts for this or not, is that AI wants to be helpful. It
Yes.
wants to give you, like we said earlier, an answer, even if it's wrong. How do you account
Yeah.
for the wrong answers?
My AI hallucinations.
Yes. But
Yes.
put it simple, put a much better way. Yes, AI
Yeah.
hallucinations.
Yeah. AI will definitely hallucinate. Right. That's for sure. I think that's why it's important to put safeguards in place. So what the technologies we try to develop, we try to put those type of anti-hallucination safeguards in place. The way in which you do this is by making sure that you in your databases of where AI is getting its data from, right? That you have different types of data sets in there, right? So we have it such that you have things that we know work, things that we don't know that don't work, and we have data sets we test the AI against that. What type of answers you're going to get from this, knowing what the answers are already. You could train it, train your model to provide those answers. But I think the key really is that you really need the end user needs to really understand the what they're looking for. Like for example, many times people go online and ask questions about using different AI, right? Whether you use Claude or Open or Chat GPT or whatever, they'll ask a question, and the AI will give you an answer. You're 100% correct, but they don't do the background work of trying to confirm whether or not this answer is correct or not. You can ask like those type of things to those type of programs, provide your references to show me how you derive this answer, and that's where you really see some of these hallucinations come out. It will give you an answer. Sometimes the answer sounds plausible, but it's completely wrong.
Yeah, I've noticed that a little bit in some of my thumbnail generations, and
Hmm.
this is going more towards the boring aspect of AI. But there, I've given my AI, in this case, Chat GPT, just a headshot, just torso up.
Hmm.
It invented an arm to sometimes do this.
Yes.
Okay. And I looked at that arm and it's like, that's nowhere in the image that I gave it, nowhere in because it's not pulling directly
Hmm.
from the video. It
Right.
just invented that arm. And surprisingly, I guess just based upon the build of what I am and all that, it built an arm, even had the right number of fingers. That was the
Okay, this is
really
what we're up to say. Sometimes you got six
yes,
fingers.
it built an arm, and it might do it for this video. I don't know. I'll have to wait and
Mhm,
see, but it built an arm, and I was like, that's me. And in
mhm,
other ones, it would use this arm. It would get my ring, even though AI doesn't know that I'm married,
mhm.
but it would put a watch on, which I haven't really worn a watch in years.
Yeah, I still
So
wear
it
one.
does hallucinate a little bit.
It will definitely hallucinate, and especially as it relates to some of the work that things we're doing and using AI. You have to be really careful. Give me an example. So something we want to do is to try to compare data across different types of drugs, across different types of clinical studies, right? And in the event that something fails, it will make up a number, right? So you have to really be diligent to go back and just make sure that the number they gave you, that it gave you, is actually correct, because it will give you a number. Sometimes the number is completely wrong,
So
and the
there's
source is
still
wrong.
there's still that human review and human
Yeah,
falsification.
yeah. You still need that. At this stage of the game, we really can't rely on AI completely for those types of questions. Now, where it has been extremely helpful is looking at protein structures, right? I mean, the team that developed it recently got the Nobel Prize for essentially taking an antibody sequence or a amino acid sequence, putting it through their program, and they can then come up with a 3D structure of that protein. It took them years to develop this, many iterations, but that has increased, the ability to look at structures and make structure predictions that will help drive drug discoveries. That has improved substantially, but it's not 100%, but it's pretty darn good.
See, when you say something like that, you use AI to evaluate the protein structures and all that. The very first thing my mind goes to, and you probably know where I'm coming with this, is
Mhm.
Jurassic Park,
Yeah.
where they were saying we use virtual reality and artificial intelligence thinking computer back in '97 of all
Hmm.
places.
Yeah.
and
One
that
of my
and that's
favorite
kind of like the
movies.
first place my mind goes.
Yeah, and I can see why because I remember that's one of my favorite movies too, is Jurassic Park, right? I remember, at the time I was still fascinated by the simple fact that they were talking about using, recombinant DNA technologies to bring to life these prehistoric creatures, right? And you see actually some of that stuff is coming into into the scientific community now, where you can look at DNA from these different types of animals way back in prehistoric time and be able to make assertions about what they potentially look like, those type of things. But more to the point, I think that going back to the structures analysis of this, you know, this has been helpful, especially trying to design a drug to a specific protein that's in the cancer, in the tumor. And to say the structure is not necessarily known, or you don't have really good resolution from the crystal structure, you can use this type of technology to give you that type of structure, and then you can begin to build molecules that selectively bind to that protein as opposed to other proteins.
Awesome. Yeah. I yeah, I'm still stuck on that whole, you know, Jurassic Park and possibly
Yeah.
I think we'll revisit that in a
Okay.
moment. Like we'll
Yeah.
talk about some of the benefits and dangers, I think, toward
Yeah.
the end of this because I have some really dumb questions that I'm sure you have been asked. I don't
I'm
necessarily
not gonna.
want to
I'm
ask
not,
them, but
yeah.
at the same time,
Yeah.
I'm kind of dying to.
Yeah. Go for it. I mean, there's
Um,
really no dumb questions per se. So
yeah,
just go
no, no,
ahead.
no. We will definitely get there. But I also want to talk about um, kind of like the scientific method because for me personally, I don't blindly trust science,
Hmm.
and I don't mean that in a anti-scientific way. What
Right.
I mean is I don't trust one science paper. I trust
Hmm.
the scientific method.
Right.
With the falsification is I think you keyed up on that a couple times um, but let's talk about the wow, my notes gave me a word that I don't know if I can say antibody conjugates. Is that it?
Antibody drug conjugates. Yes.
Yes. Um, what they are and why that they matter, and
Okay.
um, for the listeners and myself who are not in biotech, um,
Right.
what is all that?
Okay. So think about this, and if you think about drug discovery, especially for oncology, as a toolbox, right? There's different tools for different problems, right? And we want to do is to take advantage of the different, I guess, Achilles heels, the issues that tumors have, right? So one of them is that tumors grow really fast, right? The rate of proliferation is much higher in tumors than we have in normal tissues, right? So chemotherapeutic drugs take advantage of that fact, which is why you can reduce the size of that tumor in patients, and you're still going to have side effects, but we're looking for the ability of finding the right dose and the right schedule that we can give it to these patients, so that way we can more selectively kill the tumors based upon this fact that they grow faster as opposed to normal tissues, right? For an antibody drug conjugate specifically, what we're trying to do is to take advantage of the fact that tumors grow fast, but we want to be able to deliver a cytotoxic drug that takes advantage of the fact that tumors grow fast and deliver it right to the tumor. That's one way to look at it. The other way to look at this is that um, we know that there are certain tumors, a lot of tumors will have a capacity to avoid the immune system, right? So one of the things we can do is to deliver drugs selectively to that tumor that essentially will highlight the tumor to the patient's immune system, thereby using the patient's own immune cells to kill that tumor. Right. The whole goal is really to find a way in which we can selectively target that tumor for destruction. And that's what we want to do. And antibody drug conjugates, or molecules like that, have that ability to do that selectively.
So we're talking about like if I go to Home Depot and buy certain kind of weed killers that only target the root of a particular weed but doesn't kill the grass around it, kind of
Yes,
like a
exactly.
okay. Uh, and you talk about the side effects. What kind of reduction in side effects are you seeing? Are you seeing like whole side effects go away, or is it just reduced?
Many times it's substantially reduced because when we look at side effects, they're looking at different grades, right? There's grade one, two, three, and higher, right? So many times for chemotherapeutic drugs, you'll see what we call grade three, which is a significant side effect, right? And what we were trying to do is reduce the grade number of grade threes, get them down to grade one, maybe a grade two, right? So we've been able to do that by having selectively delivering that chemotherapeutic drug to that tumor, so that you don't have a lot of free drug that's floating around, giving these patients these grade three or higher side effects. And some of the side effects can be really debilitating, right? For example, you could have what we call thrombocytopenia, right, where essentially the patients can bleed out over time, or if you get a cut or something, right,
Okay.
you could have what they call neutropenia, where essentially the patient becomes, their immune system is so damaged until they become potentially have the ability to be exposed to different types of infections, right? You also have, neuropathies that happen. The patients become their nerves become so sensitive, even to things like touch, where it becomes really, really debilitating for them. So we can take all those types of side effects that are commonly associated with chemotherapeutic and move them from a grade three down to a grade one. In some cases, not even not, they might not even be there. Depends on what we use as a chemotherapeutic drug.
I have seen stories where people who have gone through certain treatments that their loved ones are not even able to touch them, whether it's
Right.
radioactive or chemical. Does something like that eliminate it and thus make the treatment process easier because now their support structure can still fully be there for them?
Yeah, I think bring up a really good point. For antibody drug conjugates specifically, that becomes a non-issue, right? Where you don't have to essentially, limit the caretaker's exposures to their loved one, right? Even for things like what we call radioimmunoconjugates, where essentially instead of using a cytotoxic payload, you use a radioactive isotope, right, to deliver that to the tumor. Even for those situations, the doses are so low and we can clear them. You don't even that's no longer an issue, for these types of patients and their families.
I do think that that's really important. Like the treatment itself, the actual nuts and bolts of it, I think are important. But there is still kind of that human touch that
Hmm.
I think doctors lost a little bit in the 90s, and I think that they've been slowly getting it back, realizing that the mind is going to control the body to a
Hmm.
certain extent, not to an
Yeah.
immediate extent, but the more positive that the treatment process is, the more that the patient is going to want to fight for it.
Exactly. I mean, that's exactly why I think one of the biggest advantages I think is minimizing and reducing these side effects, because chemotherapy is really tough for a lot of patients where they're exhausted from the treatments, and the recovery time takes longer. And if you're an older person, right, that makes it even worse because it's just you have your age issues, and you also have now the chemo on top of it, right? It can be really debilitating. So in some cases people just say, look, I just don't want any more of this. I've had enough. I'm just going to go on my merry way and let this take its course. And I think
I,
that we've substantially reduced that in particular.
I fought my fight. I can't fight anymore. Yeah.
Yeah, sometimes that happens, right? But I think that now with these new targeted therapies, that becomes less of an issue.
So, what makes a good target in cancer therapy?
Yeah, so something that is selectively expressed on the tumor itself, right? And we want something that's what we call high in the tumor, low in normal tissues, right? So, because when you inject the drug systemically, it's going to go everywhere, right? But we want it to accumulate in that tumor and not accumulate in normal tissues. So that's one of the first things that's going to be important is that tumor selective expression. The second thing that's important to make sure that it's high, right? You need a certain level at which it needs to be expressed in the tumors. So excuse me, so we can get that delivery right to that tumor so that we can deliver enough of the drug to that tumor to have an effect. And in our case, with antibody drug conjugates specifically, we need to take advantage of the biology of the tumor so that that drug is released from the antibody into that tumor. And then the drug can find its intracellular targets to kill that tumor. What I mean by that is many times the drugs that we use essentially either inhibit DNA synthesis, which will cause the cells to die. Essentially, we call it apoptotic cell death or programmed cell death. Or two, you prevent the cells from dividing, right? So we have the anti-proliferative effect. So what happens there is that once you inhibit the cells from dividing by inhibiting things like tubulin growth, then that also induces apoptotic cell death or cell programmed cell death. So those are the key things we want to see specifically from our targets. High selective expression on tumor cells, being able to incorporate the drug inside the cell and then release that drug in those tumor cells.
And where do you see these ADC programs? Where do they usually become difficult? Where versus like the traditional type of treatments?
Yeah. For us, there's a few areas where these are more difficult than your traditional chemotherapy. And I think one is that you got to make the antibody, right? And there's certain things we need to take advantage of when we make those antibodies. And this is where area where I think AI is going to be important because one of the challenges that's been faced previously is that since these antibodies are not engineered by the patient, they're engineered by us as scientists. We have to make sure that when we inject these antibodies into the patient, that the patient's immune system won't recognize these antibodies as foreign and then get rid of them, right? So there's a few things we can do. One, we can make the antibodies more human-like, right? We call that humanization of the antibody. The second thing is that we can engineer the antibody or these cells to produce the antibody so that the antibodies are really fully human. They don't have any type of sequences from other species in it. So it's a fully human antibody, and the patients won't recognize it as foreign. And then on top of that, we use machine learning technologies to make sure that we don't have these things what we call T cell epitopes, which is how the immune system is going to respond recognize these antibodies being foreign. Make sure that there's certain motifs, what we call them in the antibody, or sequences that will elicit an immune response. We make sure that those have been eliminated as well. So we use machine learning approaches to make sure that we don't have or we reduce the possibility that we're going to get rejection of the antibody drug conjugate or the antibody by the patient.
So I think, and I mean that was a great explanation, but I think when it comes to the difficulty, and I try not to get into politics or fringe conspiracy theory,
Yeah.
but there are elephants in the room that I think do need to be kind of discussed,
Hmm.
particularly within the past, oh, I don't know, 6 years and mRNA type of things. But
Right.
you say that you try to get these antibodies to be as human like, without giving away like patent information or
Right.
whatever. Um, how do you do that? You don't have like somebody, you don't have like Steve in the back and just training them for antibodies, right?
No, no, not at all. It's a very defined, specific process, right? And it's over years and years of developing antibodies, decades and decades of developing antibodies, right? So we've learned a lot over the whole process. of doing this, which is how we've been able to define what the rules look like for developing these antibodies, right? So it's not, some Joe Blow in the back just making up stuff like you see on TV, where you have these, you walk into the lab, everything has a color chemical, and they're just mixing stuff together and laughing maniacally. It's not like that, right? So it's really a structured, defined process that we use to identify antibodies that not only recognize the target and bind selectively to those targets, but we can make them such that the you won't have an immune response against those antibodies.
And you haven't received any pushback from like regulatory or potentially even religious groups?
Regulatory, no, because that's another thing I think people are not familiar with is that when you work with these regulatory agencies, whether it be in the United States, whether it be in Europe, China, Australia, wherever, the good thing about it, you have a lot of seasoned scientists on that committee, on those committees that know what they're talking about, know what to look for. And you can have a really good dialogue with them and say, hey, this is why we think this is a good molecule. Here's all the data around it. Here's all the controls we've run. Here's all the study we've done. And therefore, we believe that this is as we say it is. And they're able to understand the data that you're presenting and then ask specific questions that either they're going to challenge the data or they're going to ask specific questions for clarity around your data sets. So it becomes a really good interchange and dialogue. But after so many years of developing these molecules, they're quite familiar with what they want to see, what they need to see, and they let us scientists know and companies know these are the things you need to show us in order to have a complete data package. And we go about our business of making sure that we have those data packages and those pieces of information that they're going to need to make a thumbs up or thumbs down decision about our molecule.
Yeah. And I actually want to touch a little bit on the whole scientific community because I think that's a huge misconception that a lot of people have when we talk about, okay, well, this scientific discovery was by blah blah blah, and then what else? Um, Again, like I know that there's a lot more to it. So when
Mhm.
you present your findings to the scientific community, which do you like better? When another fellow scientist is able to show that your method worked, or when they're able to falsify it and show that it didn't work? Which one excites you more?
For me, I think that you actually raised a really good point. I think that one of the things I think a lot of the general public don't understand is that we have a lot of safeguards in place at the different companies we work for, right? So in my lab in particular, what I would do, I have, you know, one person in my lab do a study, the other person would do the same study that the other person is doing. We look at the data sets and see how well they correlate to one another, right? So we have many times we have our own internal sets of studies to make sure that the data we're presenting, right, is reproducible. And I think that's going to be the goal. So for me, I always want to know, whether or not the data that we're generating, whether it's in-house, which we do anyway, or whether external, is reproducible. Because once we're able to share those data, I want other scientists to repeat our study. This is why we give them, our methods and our methods that we use, right, to do the studies. And once they're able to reproduce the data, then we can all talk about it as a community, say, I see this, I see that, I see something a little bit different from what you see. And then we can have a discussion about, about what that looks like. But at the end of the day, it's really come down to a consensus of what the data is telling us across multiple labs, across multiple countries. And I think that's the beauty of what the work that we do in developing these different types of cancer therapies is that we'll see them work in Europe. We'll see them work in the US. We'll see them work in China. We'll see them work in Japan, right? And all that data together combined lets you know that you're on the right track.
Yeah, I think that that is definitely something that a lot of people need to understand. And like I said, I'm a layperson
Mhm.
to some extent. Like I've not gotten into the scientific community, you know, more than high school.
Mhm.
But like I said, I do respect the whole process, because we've definitely seen bad science
Oh yeah.
where there's just like one source that cannot be reproduced or is using an exotic material that no one can ever get their hands on. We've seen that out of China in a lot of engineering workspaces. Oh, we've
Hmm.
got this new way of forming graphene, and it's like, okay, but nobody in the world can produce it. So what do we actually have?
Right, right, exactly. You know that's exactly the same thing that you see in the scientific community and in the biotech community as well. You see somebody write a paper, and then nobody else can reproduce that paper, and then that becomes a problem because if you have a whole bunch of people saying that I can't reproduce your work, there's a couple of ways to approach that. And what I like to do is I say if someone were to approach me saying that, hey, read your paper, we looked at your materials and methods. We can't reproduce your work. Then, okay, I said, okay, let's talk. Let's talk about exchanging materials, right? Because maybe the material you're using wasn't the right material. Maybe the material I'm using wasn't the right material, right? So let's just exchange materials and let's have a discussion around what that looks like. And I think that if you're really truly dedicated to that scientific method, you welcome that type of exchange.
Yeah, I definitely agree with that. And I wish more people would not go to the school of Dunning Kruger,
Yes, exactly.
because there's a little bit too much of that. And I think that it is still important to question the science, honestly question the science,
Right.
and say, hey, and even attacking it from a personal angle, like, look, I don't know that this feels right, and then it's like, okay, let's have a discussion why it doesn't necessarily feel right, and here's the data. So let's see if we can bridge that gap. I think there needs to be more
Yeah.
discussion with lay people who don't necessarily feel like something
Right.
is right.
I know. I get that all the time as well. And for me, it depends on the nature of the discussion. If the nature of the discussion is to really learn, then I think those discussions are fruitful. If the nature of the discussion is to push an agenda, then those discussions won't be really fruitful. You see that all the time
On
on the
either
internet.
side too.
Yeah.
On either side, because like you can't really force the feelings to, it's like you need to be able to put your feelings to the side and evaluate
Mhm.
something critically.
You
And I
do,
think,
but I think you also need to have the knowledge base to do so,
yes.
right? I think that give an example. Like if I were to have a discussion with somebody about, say, something I'm not knowledgeable about, like architecture, right? Building structures, right? I don't really have the basis to know the right questions to formulate, and I really wouldn't know, if they get down to the nitty gritty details, I wouldn't know if they're telling me what they're telling me is true or not. I may come into the discussion with my own biases and opinions, right? But my opinions and biases might not be necessarily based on any type of true knowledge and not even necessarily mastery of the subject, but even a basic level of understanding. I've seen people I went to high school with who I know they failed biology, but they want to have these detailed discussions about science, and they don't even know what DNA is. So I mean, you can't really have a meaningful discussion or exchange when that's the case. You see this all the time on the internet, like on like what we're watching these TikTok videos, these people who have these conspiracy theories about stuff, and it's like you can't really have a. And I've seen scientists and physicians try to have discussions. I think it's a waste of time because they've already, they're coming in with their own biases. They're not going to listen to someone who's a professional. I look at this as almost like it's like I'm a pilot as well, right? So no one goes to the pilot and says, you really should have tried that crosswind landing instead of this approach you took to fly the plane.
So bring up, we'll take a little side trick on this one. So you said you're a pilot. Do you keep dipping your nose to get over the horizon? I That is
Is
so
this a flat
so
earther thing?
yeah, yeah. I'm not a pilot.
Uh-huh.
The most I've done is like flight simulators on the
Uh-huh.
computer, and that's nowhere near real flying. I mean, they can simulate air going over a wing
Oh
fairly
yeah.
well these days, but there are things that you're missing with even like the most advanced flight simulator. And
Hmm.
I love that argument. It's like, no, the pilot puts it at the horizon, and the horizon is as they're going is as long as you're
Exactly.
following that, you're following the curve and all that. But yeah, obviously,
Exactly.
I am not a flat earther.
Yeah. Yes, and you're 100% correct. I mean, that's one of the things they teach us. You keep your nose on the horizon, right? You keep, and especially if we're doing what we call steep turns, nose on the horizon, do your steep turns, right? And they even have now, if you're playing like planes like the SR-71, things like that, you can actually see the curvature of the Earth,
Yeah.
right? So you can see these types of things.
And I was a radar tech in the Navy, and so
Hmm.
we had radar systems that definitely could see beyond the curve of the Earth, just based upon how the signal is able to bounce off the atmosphere. And we had some radar systems that couldn't, that were
Right.
very much line of sight.
Right.
And standing up on the bridge of an aircraft carrier, those things are huge. When we're pulling up into an island, into some kind of coast, we always see the top, and then we see, eventually as we get closer, the beach. So we'll see the
Hmm.
top of the island, and then we'll see more and more and more as we get closer. And
Right.
so that's how it's like, say what you will, I've been there.
Right. Right. And I think that's it. It's like you really have to, acknowledge the fact that, certain people's knowledge base is limited. Certain things you see are limited. Certain way you search the internet for the information can be limited and can be biased. I think it's important to make sure that if you really want to know the answer, that you really try to look at different sources. I mean, real sources, not some Joe Blow who's selling some snake oil. I'm talking about really go to the source, go to the scientific literature. If you don't understand, ask somebody who understands it. They can hopefully walk you through the process. When the times when I've had exchanges with people who aren't doctors, who aren't scientists, and they really want to understand, the science behind cancer, it's easy to walk them through that process so that way and enlighten them in terms of what that process looks like. It's not what you think it is sometimes.
Yeah. um, like I said, I think that we need to do better as a species, and I think on both sides, because I mean,
Yeah.
when you have somebody screaming at you and you're trying to, you know, talk a little bit more calmly and more confidently, it does kind of, for some reason, make your position sound weaker, which is so weird to me. But
Yeah.
we got pretty far off.
Yes.
Let me try to wrangle us back into like AI and the workflow that you do, and specifically,
Yeah.
where does AI fit in your research workflow?
Yeah. It depends on what I'm trying to accomplish or what we're trying to accomplish, right? So earlier I mentioned before about using AI to help identify targets, right? We're also using AI to help us make sure that the antibodies we're developing, don't have the patient won't have the immune response to it, right? So the AI for the way we use it is a way in which we can make better therapeutics to treat cancer patients. That's the ultimate goal, right? To make better therapeutics. And what I mean by better therapeutics, something that has really good efficacy, long-term durability, and minimal to no side effects for the patient. That's what we're going for. You can machine usually when we use machine learning for that approach. Where I think that it's coming to where I think we're starting to get better at, and hopefully we'll concurrently develop more machine learning methodologies to help. This is in the identification of the patients who are most likely to respond to these therapies, right? So, and how you design your clinical trials is another area in which machine learning approaches are being applied to that. So, in one way in which we can identify patients that possibly would respond to a drug is by many times when a cancer patient comes in to see their oncologist, they will take a sample of that patient's tumor, right? And then we'll have these technicians that come in and essentially make thin slices of these of the patient's tumors, so that we can begin to essentially look at the architecture of that tumor, right? So one of the things I mentioned before is that we're looking for something that's on the cell surface of the tumor that expressed in high expression in the tumor. You need a lot of it in the tumor. So we can use these methods called immunohistochemistry to identify what that protein looks like in that tumor in terms of expression. We see if it's cell surface, we see if it's inside the cells, we see the levels that it's expressed, sometimes high, medium, and low. We define what that looks like. And then from that information, we can then say, okay, well, this patient will probably most likely respond to our therapy, and this type of person that we want on our clinical trials, as opposed to somebody who might not have the certain characteristics, and they probably won't respond. So you don't want them on your trial because you're just wasting your time, right? So you say, well, I'm gonna exclude this patient who doesn't fit the profile. I'm gonna include this patient who fits the profile, and then we'll see whether our drug has an effect or not.
Okay. And your AI models, do they how broad are they in scope? Like, have they been able to generate ideas or prioritize certain targets that you may not necessarily have, considered in the first place? Like, is it able to uh, bring you
Mhm.
something new in order to do even more testing?
I think that what I've seen it work really well is in terms of making combinations, right? So many of the antibodies that we develop, we call them monospecific antibodies, right? They only bind to one target. So many times machine learning technologies can help us identify multiple targets we should be targeting in that tumor, right? And I think that's where I've seen it come into play and be very, very helpful to identify what that could potentially look like. Because one of the things I think people might not understand is that tumors, we call it very heterogeneous, right? So what that means is that tumor A might be expressing targets A and B. Then the tumor cell next to it might be expressing only target B. The other one next to that might be only expressing target A, right? So what we need to do is identify what that whole profile looks like, and that helps us to identify what type of combinations we might want to use. Certain patients might have certain types of genetic abnormalities in their tumors, which makes them susceptible to drug A but not drug B. So we want to make sure we identify those patients that are more susceptible to drug A and not drug B, right? Most times, so we can use it for that type of thing in terms of trying to identify what the right patient cohort's going to be that will possibly respond to our drug. Because I think that's going to be really, really important to make sure that we do the best we can to get the drug into the patients that we believe would have the highest ability to respond and have the highest success rates.
Okay. And so the feedback loop that you have between the computational prediction, what does that look like between that and a lab scientific validation?
Right. So I think the data is you do both, right? So it's neither one or the other. You do both. Because many times what you'll get a prediction from the AI, right? And you need to go back in your lab and confirm that does this make sense or doesn't it make sense? Did it work? Didn't and if it didn't work, and then you can go back and feed that information back to your algorithm to say, hey, you gave me this is really doesn't work. Let's go back and revisit this, and here's exactly why it didn't work. So it's an iterative process, to go through this whole thing. So I think that's where I think the strength of AI is. I think that the challenge is going to be there's AI you develop in house, and there's this publicly available AI, right? I think that the strength that for a lot of drug developers is that you have data that you generated in house that will begin to help you make better decisions about what to do. Because one of the things I think that the listeners might not be aware of is that for many of the drugs in oncology, the clinical success rate is relatively low with a lot of the drugs in oncology. And it depends on the type of molecule that you've developed. So if you're developing a traditional chemotherapeutic or a targeted chemotherapeutic drug, the success rates for those are about 3 to 5%, right? For antibody drug conjugates, they go up to they're essentially, double or triple that number, right? It's about 11%, maybe as high as 20% on the top end. That's from the start of phase one all the way through approval. When the regulatory agency says yes, you generated enough data to show that this has a tremendous impact on the survival of the cancer patient's ability to survive, we know it's good, right? So when you look at those numbers, that tells us we have a lot of room to improve in terms of developing this cancer therapeutic. The jury's still out in terms of how machine learning can impact that, but I think we're starting to get some little bit of information, not statistically significant yet, where companies are developing a lot of their drugs via machine learning technologies and showing that some of these drugs have really good activity that they might not have seen using traditional method, which takes a long time to get there.
Yeah, I think the pandemic really kind of showed us how different success rates, um, because they were talking about, okay, so the success rate of the COVID-19 vaccine was so much higher than like the success rate of the flu vaccine, and
Mhm.
we've been taking that year over year for I don't know what decades,
Yes.
and it's like, okay, well, wait, if because a lot of people thought, and I will admit that I was one of those as well. That's like,
Hmm.
okay, you get the flu vaccine, you might feel like crap for a couple of days. You might even think you got the flu because you get some flu-like symptoms, but then you're not going to get it.
Right.
You're not going to get it again. And now we're finding out it's like, oh no, now that's not necessarily the case. That I think what did COVID say? Like 45% effective or something? I don't even
Mhm.
remember the number. It's been a while.
Right. I think that's because people don't understand these entities change over time. You have different strains of the flu, right?
Mhm.
You have different strains of, right? You have different variants, right? And they change over time and they change in different regions. You see the same thing with cancer as well. The cancer will change over time with treatment. So you need to be ready to be able to make these types of adjustments, right? So this is why you have, um, in terms of vaccines in particular, why you are able to make different, why you need different boosters and different vaccines over time for the same thing, because the molecules will change the cell surface proteins over time. You need to be, and scientists try to identify what those are, then make the vaccine to target that.
Yeah. Um, and also just like the fact that human bodies are short of what some people might think, we are
Mhm.
not perfect.
No, no, and it's very dynamic. It's not static. So that's another thing.
So I did want to ask a couple of my dumb, hopefully fun questions.
Yeah.
And the first one is going back to like Jurassic Park with AI bio research.
Hmm.
How close are we to either bringing back dinosaurs or bringing back species that we killed off?
That's a good question. The thing, this is not my area of expertise. I can tell you what I've read, right? And I don't think we're close to doing that anytime soon. It's not an easy process to go from the DNA sequence into a new life form or something that's been extinct for a long time and bring it back, right? That's difficult to do. And many times, even the DNA sequences that you get, many times they can be degraded over time. You get partial sequence here, partial sequence there. I don't think we're anywhere close to that yet. But what I have heard about is that people potentially looking at seeds, for example, that might be from a different part in time, right? And maybe it's from those seeds they might be able to bring some of those ancient plants back. But remember, the environment was completely different back then too. So probability, even if you could do it for survival, is going to be pretty low, possibly.
And the whole Ian Malcolm, you only thought about whether you could, you didn't bother to think you should if you should.
Right.
Yeah, that kind of thing. And have any of your models accidentally given superpowers?
Not that I'm aware of. I haven't noticed anything that I've gained from this. So,
I, no telepathy, no advanced healing. I mean, advanced healing would be really great.
yeah, that would be nice. And I have to talk to my wife. She might have a different answer. So
All right. Well, this has been a really great conversation. We're getting close to an hour, and like I said, I want to be respectful of your
yeah,
time and everything else. But before we wrap,
yeah.
uh, first thing I'd like to ask our guests is, where can people find you?
Yeah, so I'm easy to find on the internet. My name is Dowdy. And so if you Google my name, Dowdy Jackson, I am easy to find, right? So that's one part. And like you can find me on LinkedIn. If you find me on Instagram, that's most of my flying videos, mostly aviation stuff there. But I'm easy to find. I mean, it's easy.
Awesome, awesome. And for researchers, founders, business leaders, or even families who are listening to this in AI and cancer research and immediately feel both hope and uncertainty, what is something you want them to understand where the work is today and where it's headed?
Yeah, I think that I understand both sides of the coin, right? As a scientist, I'm excited about the potential. And then on the other side, people might be fearful of different types of things that they hear about machine learning, AI technologies, especially that I watch CNBC almost every day. All you ever hear about AI taking jobs, AI is going to do all these bad things, right? It can be out of control. I think there's too much sci-fi movie stuff in there, but
A little bit.
I think that in general, I think if we use it wisely and we respect that that AI is not going to be the answer to everything, it could potentially give us some really really tremendous advances and changes, in our society to help everyone and help humanity in general. So that's the way I see it. I say I have more of an optimistic view of how we can use it. It's just a matter of making sure that you use it in a way to help, you know, humanity.
Absolutely. I think that is one of the key things. I think that overall, scientists like you, doctors like you, they're overall trying to help humanity, uh, whether they want it or not.
Yeah.
Dr. Jackson, I want to thank you again so much. This has been a really great conversation. I really appreciate because it you are taking the AI out of the abstract and putting it into an important area, one that we were promised right from the get go, and to see that it is actually happening is inspiring.
Right. Well, I
And
appreciate the invitation. Thanks for, bringing me on and giving me a chance to talk about one of the things I love doing, which is developing new cancer therapies for patients. Love that stuff.
absolutely. And for everyone else who's watching, the takeaway here is not that technology magically solves hard problems.
Yeah.
It's that the right people using the right tools with the right scientific discipline can push difficult problems forward. And when the problem is cancer, even forward motion matters. So I want to thank everybody for tuning in to Stack and Startup. If you've enjoyed this episode, make sure to like and subscribe so you do not miss future conversations around business, technology, and growth. You can find us anywhere you get your podcasts. And if you want to support the show directly, you can become a patron at patreon.com/stack and startup. Until next time, make sure to model a future where all people can win the day, and we'll see you next time.